A seated knee flexion is all about restoring range of movement into bending of the knee, flexion of the knee. And we can do this first of all using a towel or a band or anything like that to assist the movement of the foot going up into flexion, into bending of that knee, going up as far as you feel you can go until you feel the tension in the knee stops you, and then coming back down again. And we can do that first of all with assistance, but ultimately what we want to then develop into is doing it with no assistance. So you're using your muscles in order to create that stretch and that flexion of the knee, going all the way back down, squeezing the quad when you extend as well, and then go back up into that flexion, and just repeating that for, generally speaking, 10 to 15 repetitions regularly throughout the day. Also, what we can do is add some overpressure after this, so stretching with the hand once you feel able to do this, but this is usually not going to be until the flexion has progressed quite a lot. The other thing that you want to work on if you're doing post-op rehab is extension, and the hyperextension exercise is an amazing exercise, which if you click on this video, you'll be able to see how to do it.